Hello, everyone, and welcome. Thank you so much for joining us today. My name is Amna Imtiaz, and I'm the Manager of Customer Success here at mConsent. So I'll be your moderator, and I will also be conducting the demo session for today. And I'm actually really excited to have all of you with us. So before we dive into this, I actually just want to give you guys a quick snapshot of who we are. Most of the people who have stayed with us throughout years already know this, but at mConsent, we're actually really passionate about helping dental practices simplify their day-to-day operations. And it's anything from digital forms and automation to patient engagement, but the main agenda is always so that the teams can focus on what really matters, and that's patient care. And that's always been something that we have been very passionate about, and we make sure that we keep that with us moving forward as well. So also, actually, I want to take a quick moment to celebrate something very special. Next month on November 10th, we have our 10-year anniversary coming up. It's a full decade of helping practices go paperless, simplify workflows, and make patient care more efficient. So we're very excited for that. And it's honestly such a proud moment for all of us, for our clients who've trusted us, for our partners who've grown with us, and for the incredible team here at mConsent who've built this success step by step. And in these 10 years, we've gone from a very small idea about digital forms to a platform that actually supports thousands of providers across the country. And today's session actually really reflects that journey as well. We have Jennifer joining in, who will be taking us through her journey and what mConsent was able to do for her as well. So on behalf of our entire mConsent family, thank you so much for being a part of this milestone with us. And we're very excited to continue innovating and supporting the dental and public health community. So as far as the lineup today is concerned, we have a very fantastic one. You'll get to meet our team who's behind this session as well, and then hear from our amazing guest, Jennifer Hamilton from Kids in Need of Dentistry. She'll be taking us through her journey of getting to know mConsent and utilizing it to streamline processes at her practice. And then you will also get to see a product demo in action. So before we dive in, actually, I want to take a moment to introduce the team behind today's event. So joining me today, we have Vanessa, our VP of Customer Success and Support. I myself will, as I mentioned, will be moderating the event and also will be conducting the demo session. We also have Michael, who's our Business Solutions Consultant. He will be hosting the session and the session with Jennifer as well. We also have Nick joining in today. He is our product manager and honestly, like all-rounder. He's one of the best that we've got, and we have him here today to go through any questions or any suggestions that you guys might have about the product. And he's a very senior resource that we have, and we're really excited to have him in here today as well. We also have Nancy joining in, who's our clerical customer success manager. She will be co-hosting and conducting the Q&A session. So moving on, I do want to hand it over to Michael. Michael, why don't you take it away and introduce Jennifer?
Awesome. Thank you, Amna. Hey, and thank you all for joining us today and taking time out of your busy schedules to meet with us. We're really excited to have you here today. Man, we really do have a wonderful guest speaker for you right now. Her name is Jennifer Hamilton. She works at she's the office manager for Kids in Need of Dentistry. Jennifer's been in the dental industry for over 13 years in the public and private sectors, and she's been with Kids in Need of Dentistry for over a year. In that time, she's been one of the driving forces behind the practice going digital. And she's joining us today to share her story and the impacts that journey is having in the organization. Welcome, Jennifer.
Hi, thank you, Michael. Thanks everybody for inviting me. This is so exciting. I'm excited to bring the company, the nonprofit that I work for, out here. So to let everybody know about it and how mConsent is greatly helping us step into a more impactful place in our patients' lives right now, and especially in public health. So I am one of the managers for Chopper Topper, which is part of Kids in Need of Dentistry, and we are the oldest and biggest mobile dental sealant program in Colorado. And Kids in Need of Dentistry has been around since 1912, so we've been around for a very long time. And through this over 100 years that we've been around, obviously we've gone through many different reinventions and changes, and it's always with that same mission of providing amazing, affordable dental care for everybody in the Denver metro area, all the children, regardless of their income, and also providing resources for their families, because we know that oral health is it's the biggest disease for children. It's preventable, and it impacts the whole family as a whole. So myself and my other manager for Chopper Topper came in over a year ago, and we looked at our program and we were trying to figure out what we could do to better serve our patients, our demographic of patients, because in public health, sometimes it's looked at as if public health doesn't necessarily get all the great dental choices that you can get in private practice sometimes. And we want to be able to offer the best that we can for all of our patients. And number one on our list was taking this program electronic. We have been completely paper in our mobile dental sealant program from the beginning. So we are all paper, charts, consents, everything. These papers are going through so many people's hands just to make it into Medicaid and to get our referrals into the clinic. It was just taking too long. It was too inefficient, and it was putting a lot of strain on our providers. The liability of carrying around that HIPAA compliance, it's a lot. And in the dental industry, we don't really get a choice. There is that umbrella of dental compliance. Before you're serving any patient, there is compliance that you have to honor. And, that's part of HIPAA, that's OSHA, that's like medical emergency prep, that's going to be, Medicaid and your fraud and waste on that. And there's a lot of things we had to comply with. And that's a lot on a dental hygienist or a dentist. That's a lot to shoulder. And so Chopper Topper needs to be able to provide security, one, for their providers, and right next to that is for their patients. We're serving some of the youngest patients here in Colorado, the most vulnerable families, and we needed to be able to supply a level of security for them.
You looked at a lot of different providers during that process too, didn't you? How many people did you look at or try to find to try and help you guys out through this process?
Yeah, so we actually did, I think it was 41. So, and I was totally in last night, I think it was 41. So when we started the process, I started to look at these major software companies that are offering great solutions, like scheduling, consent forms, electronic health records, and see if they could help us. The problem I came up against was that most of them are developed for private practice, and public health is not included in this structure that they have. So we were being asked to kind of conform with what they could offer, and that's just not a choice. We don't have an option of having one location. We have 130 in our mobile sealant program, and we don't have one level of clientele. We have, up to 7, from preschooler, first grade, second grade, third grade, fourth grade. We have a lot of different people, a lot of different patients. And mConsent, I think, was third to the last that I went in and demoed, and they were the only ones that could actually not tell me directly no when I asked them if they could give me certain tailoring to their programs. And Brian was amazing with customer support. He actually told me, he didn't tell me no, he said, let me get back to you. And that was like the in that I needed. And just being able to ask and see if they could do some of these things to help us in public health with our organization was huge. So yeah, and we started from there. And Brian's been doing it for months now. We talked to Brian for over 3 months. I mean, amazing customer service. Anything that I asked him, okay, before we commit, can we do this? Because this is a make or break. And he was able to come back every time. He's so patient and diligent, and he really helped us kind of build what we could do and how we could build this structure around our program. And
you went through and you vetted a lot of the business that you were looking for the HIPAA. Why was that important for you? Oh man,
like I was saying earlier, number one for me as a provider is a dental healthcare provider. It's that umbrella of dental compliance. It is like what I say, it binds you. So anybody in healthcare, anybody in dental knows that there's certain guidelines you have to follow for any clientele, and that's that whole umbrella of compliance. That's your HIPAA, your OSHA, your Medicaid, your sedation and anesthesia rules, your whole operations of how you're taking care of your patients. You're kind of bound by that. That's your foundation. And if you don't have a strong foundation with that HIPAA compliance, then you're going to have problems building on top of it. And we wanted to do electronic consents because we wanted to build on that HIPAA compliance to make sure that we can provide that for all of our families and children that we're taking consent form from.
You see a lot of families too. How many do you see per week, roughly?
Oh my gosh. So a ton. And that depends on the school. So right now we have 2 hygienists. We do 2 schools a week. So we can see anywhere from 30 up to 100 plus. Right now, total mConsent forms that we've brought in since we started school in September, we've processed 853 consent forms through mConsent. We also have 85 right now waiting in the inbox for our next week's schools. So it has been a constant in motion, not 8 people a day. We're hundreds, and we'll be in definitely plus in the thousands plus by the end of the school. We'll be at least up to 6,000. So that's a lot of people, and that's a lot of security that you need to provide to them. So, and we've been able to do that with the encryption, with having a encrypted dashboard, and being able to provide a consent straight to healthcare, just like you can at a private practice in dental or in your medical office. So we can do that now with it.
Well, have the parents said anything? Because hey, look, I've got a 14-year-old at home.
Yeah.
And with the busy schedules and dealing with kids and all these times, what impact has it had for them? Do you know?
So for the families, I think it's really impactful. What's really impactful right now is the level we're at is when we bring it to the schools, and we're very close with school nurses, when we're able to sit down and talk to them, and all of them are registered nurses and they've worked in hospitals and things, and we're able to bring this to them, and they're like, wow, it's you're able to provide a huge level of security. And it was actually yesterday, I was able to, a nurse was asking me about a child. I was able to bring up my laptop right then, and she's like, do you need rosters? Do you need to wait for the paperwork from your assistant? And I'm like, I don't even need her on site. It's like I can look it up online right now on the dashboard. I could look it up and I could tell her, yes, he did sign up, and no, we can't see him because he said no, he didn't fill this out and he doesn't want him seeing us. She's like, perfect. She's like, that's a level, that's a really cool level that you can bring in. I think they're very impressed with that, and I think that really helps them trust in us as a community. So,
Jennifer, this has been such an eye-opening for us. I was so excited to have you come in and join us today. And that is kind of what we try to strive to do with mConsent, and have that kind of impact, not just for the practices, but also for the people that those practices are serving. Because at the end of the day, if we make it easy for them, it's easier for us, right?
Yeah, exactly. It's great for all of it. It's great for our organization. We're taking out the links where we have risk factors involved, being able to provide a security blanket to our patients and for our providers. I want you to know, provider-wise, we've timed this. When we take paper consents, do them by paper, process them, put up the data, all that stuff, it takes about 14 minutes a student. When we use mConsent, it takes it down to 4 minutes a piece. From 4 to 14. And that's why we push it so heavy. It's like, one, it's the better and it's a safer solution. But two, for us as providers and with assistants and limited hours for the organization, it saves us a lot of money being able to say, time is money for us. There's only 2 hygienists right now, so with hundreds of kids. So it just makes sense for the organization.
Jennifer, thank you so much for joining us today and sharing your insights with us. They're so valuable. And I'm sure you guys keep that great work going. And we're so happy to be partnering with you to help you guys have the impact that you're having. At this point, I want to kick it back over to Amna and continue on with our program for today.
Thanks, Michael.
Thank you so much, Michael. And Jennifer, I cannot thank you enough for the incredible insight. Honestly, I loved hearing the practical steps you took to, have such a measurable impact across your practice. You work for a product and you believe in it, but it's always such a wonderful experience hearing from clients like yourself when you can actually see the difference that you're able to make on a day-to-day. And I'm pretty sure that our entire team is really, really happy to hear that from you as well. So thank you so much.
Yeah, they've been great. Thank you so much.
Of course. Thank you. Now, moving on to our demo. So I'm actually very, very, very excited to walk you through one of our most anticipated innovations yet. It's our all-new self-check-in kiosk. And this product was actually designed with one goal in mind: to make the check-in process faster, easier, and completely seamless for both parties, the patients and the front desk office teams as well. So before I jump into the live demo, I do want to quickly touch on the why behind the product. So over the years, I myself have personally worked in, healthcare as well. And even working for the company, we've heard from hundreds of practices, large and small, about one common challenge, right? The bottleneck at the front desk, especially patients waiting in line to fill out patient forms, staff re-entering the same data into the system, and those busy mornings when you have rush hours that throw off the entire schedule, right? So our intention with the self-check-in kiosk is basically answering that problem. It digitalizes and streamlines the entire process, allowing patients to check in on their own, and while the data actually flows automatically into your system, completely eliminating the front desk pileup that we usually have. So that's basically the intention behind it. Usually the check-in process is pretty manual, and it takes about 8 to 12 minutes per check-in, costing a staff up to $240 per day, because you're chasing paperwork, manually entering data into the EMR, and it requires a lot of staff follow-ups as well, which can be a burden on your team, right? So if we take away from that, we do have the semi-automated process as well. If we can move on to the next slide here. So again, if you utilize any sort of digital platform, a semi-digital workflow can reduce errors, of course, and reduce the time as well. But with the self-check-in kiosk that mConsent is launching, we completely, renovate the entire process, so to speak. So near zero errors, 2 minutes per patient. And as far as a return on investment is concerned, that is pretty great. If we can move on to the next slide here, that will show you exactly how. So a manual check-in time, that's about 8 to 12 minutes, and staffing costs $240 per day. With the automated mConsent workflow with our self-check-in kiosk, the staffing cost is only $40 per day approximately, with only up to 2 minutes of time that your team has to put into that process. And the return on investment is actually great. $200 per day, any team's going to be really, really happy with that, of course. And depending on the number of patients that you have, that of course, scales up as well. So how does it actually work? If we can move on to the next slide, here you can see the appointment check-in interface. How the patient checks in, they do have 2 options available, right? They can either enter their patient details or scan the QR code for the appointment confirmation that they have received. If they do select the patient details section here, the next slide is actually going to show you how that would look like. And they can either enter their name, of course, as long as they actually enter their last name, even if in the first name they use a pet name or anything else, the system should be able to pull up the information. They would be entering their date of birth here as well. That is the most common way to do it. If they don't want to do it and they do want to opt for the phone number interface, we do have that option available as well. They can enter their phone number and their date of birth, and that should still pull up up their information. So they'll only have to submit it to go through the next section. Now, let's say they don't want to opt out or opt for this one, and they do want to opt for the QR code scanning section. So if we are doing that, then in that case, we can scan the QR code. Give me a quick second here. So you can scan the QR code that was sent to you in the appointment confirmation and email section, or send it to you through the SMS that you will be receiving for your appointment confirmation as well. If that is the case, then moving on to the next slide here, you will get a pop-up that will give you confirmation on the appointment that you've made as well. So appointment for Jane on a Friday, October 10, 2025 at 2 p.m. So if the details align with the appointment that you have made, you will select OK in here, and you will be able to move on to the next interface here that will allow you to see the patient details. Now, throughout the life cycle of a patient with a clinic, this information can change. So you should be able to edit this information as well in this interface, but let's say it doesn't change, right? So in that case, you would just proceed, and the system will recognize the details and take you through the next section here. So this is something that we are excited about, but it is again optional because we want to be mindful of the operational needs and the difference between them from practice to practice. Not everyone is going to want to have their patients take up a photo for their identification, but for the practices that do need that, you can actually add this to your patient record for identification. It only takes a second. So if you would like to do it, you can capture the photo for your patient, or they can skip it as well. So if they do decide to skip it, the next wonderful feature that we have is actually capturing the insurance card. So you can capture the front and the back of your insurance card. This will help you check your coverage faster for the patients, and then capture the back of it as well. Again, this option is completely optional, so to speak. So you can skip it if you would like to, or you can capture it to have it enter into your patient details. So moving on to the next slide here. Once that is done, let's say one of the greatest pains that the front desk staff have actually told me like numerous times, you guys will connect with that as well, is if a patient hasn't completed their forms before coming in, takes up a lot of time, throws the process back, and then your team has to put in the time to actually get that done before they can see their doctor. So in case that happens, our kiosk will be able to identify that from the system, and they will tell them that, hey, you got 4 out of 5 forms that you didn't complete, so please complete that before you see your doctor. And you will be able to select one method of communication to receive the forms and send them out to your patients as well. So it can be either through text or through email. Let's say you send the forms out to them, they can fill it out, saves time as well, and that time can actually be utilized by your team to actually connect with the client, connect with the patient, make sure that their experience from the moment that they step into the clinic to the moment that they step out, and sometimes afterwards as well, is great. It makes them want to come back. That's basically the intention behind everything that we do, right? That they feel great, that they feel taken care of, and they want to come back. So it will let your team do that. Once they do it, they can actually see the waiting screen where it will tell them that their check-in is complete. Now we are actually working on making this completely customizable. So your practice will be able to enter a message in here that, sounds good to your team and sounds good to your patients as well. So it will be completely up to your practice to actually enter a message that resonates with you. So that is completely the process that will be customizable as far as your needs are concerned. Now coming on to the kiosk settings. So we do have a couple settings on the settings page. You can either contact support if you need any help, or you can also set up your camera orientation. You have good lighting, you want to set it up where the patient pictures look good as well. You're able to capture details, so you can do that. You can also, the wait time message that I was telling you guys about, you can create that wait time message as well and make it sound good to your patients. And then you can set up your photo preferences and also the option to log out, of course. So this is basically the interface for the settings section, and that's how our self check-in kiosk works. Again, I cannot tell you how much time our team has put into this and how excited we are to bring you to this. So I want to make sure that you guys get your due time in asking questions, and if you have any recommendations or suggestions as well, so we'll take that up. And I'm actually going to hand it over to Nancy for this section so you can take your questions. Over to you, Nancy.
So yeah, I would like to thank you for taking the time to attend our webinar today. So before we conclude, we'd like to open the floor for any questions or concerns you might have. Please feel free to ask anything that comes to mind. Anyone?
Let's see. Do we have any questions in the chat?
Oh, okay. We have one for NP or emergencies.
Clumsy on the iPad, so we only text or email forms to their own device. Okay. What else? Guys, this is a completely open platform. Please feel free to ask any questions. Even if you don't have questions related to the kiosk, you can still ask them. We have Nick here he's our senior product manager, and he's actually excited to take on your suggestions as well for the product. So what do you guys have in mind? Is there anything that we can help you guys out with, or anything that you would like to get submitted as far as your practice needs are concerned?
I see Miss Ginger has clumsy patience when it comes to her iPads. That is something we hear quite often, Ginger.
Very, very common.
I think we're good to move on. If anyone has any questions, they can always drop them in the chat, or they can reach out to our support team after. We'd be happy to answer them.
Definitely.
Same with any
Perfect.
feedback, of course.
Good to know. If we can move on to the next slide here. So guys, these are our social links. We are going to drop the links into the chat box as well. You can feel free to follow mConsent on YouTube, Facebook, Instagram, and LinkedIn as well. We have many more exciting updates regarding the product coming up. Our team is working diligently on a lot of product developments that we're going to end 2025 with and start 2026 anew with that as well. So we're very excited to get that over to you guys as well. So please don't forget to follow us. And before I end this session, number one, I want to thank the whole team for taking a part in this and putting the time into this as well. For Michael and Jennifer, thank you guys. Favorite part of the whole session. Loved hearing from you guys. But before we put an end to this, I do want to hand it over to Vanessa, our VP of Customer Success and Support. Would you like to add a few remarks?
I do. Of course. Really quick. I just want to say it's been such a joy to celebrate an incredible 10 years of innovation, growth, and partnership with all of you, all of the customers that maybe not joined us today also. All of your support and feedback over the years have truly shaped who we are as a company. Every feature we've built, every improvement we've made comes from listening to practices like Jennifer's and others. So thank you for continuing to share your voices with us. Hearing from you today, Jennifer, and from so many of our other clients remind us of why we do what we do. Your input always helps us grow and deliver tools that make your guys' days, day-to-day work easier, more efficient, and more connected. So whether you're just getting started with mConsent, optimizing your practice, or scaling your practice, our team is right here beside you. We're not just a software company, we are your partners in success, and we're honored to be a part of your journey. So as we wrap up, I just want to encourage everyone to continue following us. Keep your eyes out for upcoming community sessions. We'll have more guest speakers, more product sneak peeks, and great opportunities to learn and share from each other. And thank you again, Jennifer, for joining us today. It was so wonderful hearing from you. Always such a pleasure to speak to you. I hope everyone has a great rest of your day. Thank you so much.
Thank you for joining in, guys. Have a wonderful day. Thank you so much. Bye-bye.